I've always been drawn to help alleviate patient suffering and being able to help animals that are potentially in pain, or helping animals that are frightened, being anxious, being scared of the hospital. Hi, I'm Dr. Bethany Fackler. I am the anesthesiologist here at Western Sydney SASH. First thing in the morning, I come in, I look at our schedule to see what types of procedures we have, whether it's something like sedations, imaging and CT, or ultrasound or MRI. Look at our surgery schedule to see what types of cases that we have on board for the day, and then talk to medicine about what types of cases that they might need anesthesia for. This is our board for surgery. So we have a few imaging cases, some orthopedic cases, some sedations for either bandages or suture removals. And over here, we've already gotten our day started because this is our first CT. This patient is having a CT exam, and we're able to monitor what's happening inside via this monitor. One thing I do notice about this is that our patient has a little bit of a low blood pressure, and ideally we fix that. Daisy is providing the patient what we call positive pressure ventilation, or breaths. When Daisy provides a positive pressure breath, we see that the yellow line there, how the height of it is pretty normal, and then now she's getting a breath, you see it gets small. That tells us that this patient probably could use an IV fluid bolus. And so what we're going to do is we're going to give our patient some fluids and see if that helps improve our blood pressure. Okay, so we're giving you the bolus now. We're going to get that. We don't give it super fast. We give it over like 15 minutes. We did our fluid bolus, and as you can see, the red numbers were what we were concerned about before. The tiny one that's in the parentheses was 53, which was below what we wanted it to be. Ideally, we have 60 or above, and currently we have 70, so it looks like our fluid bolus was effective. It's really nice that we have an in-hospital radiologist, because then we get to know what we saw and imaging almost immediately, and that way we can see, do we need to do any sampling, or is there anything that we should be concerned about? Benson is here today to have a mass removed. The particular type of mass is called a mast cell tumor. They're notorious for, they get mass and they'll get really, really big. So because it is pretty small, there's not a block that I can do unless I block almost the entire leg. So in order to keep our patient pain-free, we've used other types of medications that will suffice for that. Even though I do love to do blocks for most of my patients, this one would potentially put him at risk of having cancer spread, so I'm not going to. Benson has finished with surgery, the mass is removed, and so currently we're in recovery. We're still monitoring to make sure that we're still safe, keeping our patient warm. We're gonna wait until Benson has enough reflexes to be able to swallow, and then we'll remove the breathing tube, and then take him into our hospital care ward where he'll fully recuperate. Hey, Benson. So he's got a blink reflex. There he is. Hi, honey. So what we're waiting for is for him to swallow to show us that he can protect his own airway. Hi, puppy. There's a swallow. So he's giving us 2 big swallows. I'm gonna take his tube.
Oh, funny feeling. Good boy.
Oh, how big. Oh, my goodness.
It's like, oh.
How you doing, buddy?
He's like nothing ever happened.
That's feel funny.
Now he's gonna go to our hospital care wards where he'll get some TLC from our hospital care nurses. I gravitated towards anesthesia because I've always been drawn to being able to help alleviate patient suffering. I did emergency work for quite a long time and saw a lot of patients that came to us because of discomfort, a lot of patients that needed surgery. And so I've always been very interested in being able to help animals that are potentially in pain, or helping animals that are frightened. That's my main thing that I focus on, is animal comfort, and that's with pain and also with just being anxious, being scared of the hospital. With my ERA cases, I found that some of the usual pain management strategies didn't actually work, so I had to dig a bit deeper, and this led to a desire to learn more about how different medications work and how they interacted in various disease states. And that's a lot of what anesthesia is, making protocols specific for a patient, whatever their procedure is, and ensuring that we use the safest combination for them. And while they're under anesthesia, we monitor all of their vitals, and it helps us make adjustments to that plan so that we have the best possible outcome. Well, what we're going to do is 2 different blocks to help make this limb not feel the surgery that's going to happen. We're going to use a nerve simulator today. And so this is just a device that helps us let us know that we're in the right spot. There we go. All right, now we're going to do the other nerve that helps us block the more inner part of the limb. A sciatic and a femoral block that we use very often to do a TPLO, which is a procedure that is used to correct a ligament tear in the knee. In people, that's an ACL tear. In dogs, we call it a CCL or cranial cruciate ligament tear.
Okay, bye. See you when we're done.
So we're going to head over to emergency and critical care because Dr. Michelle has a patient that has a little laceration on the nose, but we're going to try and do a repair under sedation with a little local anesthesia so that our patient doesn't have to have general anesthesia and gets to go home really quick.
So she's had her little sedation.
Perfect. Did it work really well?
Yeah,
She's sleepy.
She's sleepy. She's looking good.
Cool. For Miss Layla, she has a wound in her nose right here. And so what we're going to do is we're going to block that side of her face from basically here all the way forward. So we're definitely going to get her nose. So basically we're going to be behind this big canine tooth, and you're going to feel up into this fleshy area here where your finger almost like naturally goes into like a divot here, and that is the hole that we showed you on the skull. So basically I'm going to take a teeny tiny needle. I'm just going to go right underneath my finger here. There we go. And then we'll let that just sit for like 5 minutes or so before you do your actual procedure.
Oh, it's so cute.
Hello, Papa.
Is it okay if you just sort of like put a hand rested on her neck just for reassurance?
Yep.
Good job, Papa.
Good job, Papa. Good job, Papa.
I find my job really, really rewarding because I am able to make decisions that are very patient-focused. I get to assess a patient, look at it from its perspective in terms of what procedure it's going to have, and tailor protocols and solutions for that patient individually. I also really enjoy the amount of interaction I get with everybody in the hospital, and I also really, really love teaching, and I think that in my role I get to do that quite a lot in the hospital, and I get to help them learn more about their job and how to do it better.